I'm Mark Pegram. I'm the Associate Director for Clinical Research at the Stanford Comprehensive Cancer Institute and a member of the Division of Medical Oncology. PIK3CA is the gene that encodes for the signal transduction protein PI3K, which is a major intracellular signaling protein. It's a key regulator of normal cell processes such as cell growth, proliferation, metabolism, motility, survival, and even programmed cell death or apoptosis. Studies have shown that PI3K pathway is the most frequently altered pathway in human cancers. Activation of the PI3K pathway has been estimated to be as frequent as 70% of breast cancers overall. So this is a pathway that's frequently hijacked by mutations in breast cancer cells to create the malignant state. Moreover, activation of the PI3K pathway has been associated with resistance to endocrine therapy and breast cancer as well. PIK3CA is the gene that encodes for the PI3K protein. And mutations in PIK3CA are so-called gain-of-function mutations that are activating, that turn on the PI3K protein to cause it to be aberrantly overactivated and lead to all of these phenotypes like growth, proliferation, increased metabolism, increased ability to spread by metastasis, etc. So the gene can also be amplified by a different sort of mutation, yielding multiple copies of the gene, just as is the case for HER2 gene amplification in HER2 positive breast cancer. In about 10% of breast cancer cases, you can find amplification of the PI3K gene, and it does the same thing as HER2 gene amplification does. It causes overactivation of the PI3K protein. So overall, PI3K mutations are the second most common mutation observed of all breast cancer patients, second only to P53 tumor suppressor gene mutations. PI3K mutation rates are higher in luminal breast cancers, whereas P53 mutations are more common in basal-like, for example, triple-negative breast cancers, and also in HER2-positive breast cancers. Approximately 40% of patients with hormone receptor-positive breast cancer have PI3K gene mutations. In May 2019, a new PI3K inhibitor called alpelisib was approved in the US for use in combination with endocrine therapy, fulvestrant, to treat postmenopausal patients with hormone receptor-positive, HER2-negative, PIK3CA mutated advanced or metastatic breast cancer following progression on or after endocrine-based treatment. The FDA also approved a companion diagnostic test to detect PI3K gene mutations in tissues or even in a liquid biopsy. Moreover, PIK3CA mutations are in all of the commercially available next-generation sequencing panels like Foundation 1, and in the circulating tumor DNA assay Guardant360. So it's important to use the most recent tumor biopsy, and even more convenient to use circulating tumor DNA in real time, since PI3K gene mutations may evolve during the lifetime of a breast tumor and are more likely to be found in metastatic cancers than in the primary. So it's best to use either the most recent tumor biopsy or circulating tumor DNA to have the highest chance of detecting these aberrant mutations. The effectiveness of alpelisib was studied in the SOLAR-1 clinical trial, a randomized placebo-controlled trial of over 500 postmenopausal patients with hormone receptor-positive, HER2-negative metastatic breast cancer who had progressed on an aromatase inhibitor. Alpelisib plus fulvestrant significantly improved the survival time without progression of metastatic cancer, and the objective response rate in these patients was more than doubled. And that's compared to the fulvestrant plus placebo control arm. Most adverse events were mild to moderate in severity and generally manageable through the dose modifications that are available and with medical management if necessary. The most common adverse events are hyperglycemia, diarrhea, nausea, decreased appetite, and rash. So it's important to monitor the glucose during alpelisib treatment. And since skin rash may sometimes become severe, early consultation with a dermatologist should be considered if a significant rash is encountered.